Now, in the US, like educate me on this a little bit and maybe for the audience. We hear that English is the predominant language in the US and
That's correct.
everybody supposed to speak English, but there are, I'm assuming, supposed to be some pockets of English is not really well traded or well exercised. And it becomes critical, correct me if I'm wrong, when delivering healthcare services. How's that? Like, how many
Exactly.
languages do you cover? Is that like a problem for the medical industry, for the medical sector?
It is very much so. And here's the thing: it's considered, language limited English proficient. So even if you are proficient in English enough to order a steak or ask for where the bathroom is, when it comes to your health, you don't want to use those limited English. So it's already stressful as it is
Hmm.
to go to a healthcare provider uh, without the added stress of not being able to understand and not being able to communicate. And providers have found that if they don't use a qualified interpreter, that they increase their liability, and they're actually utilizing a lot more healthcare services because they have to add so many diagnostic services because they're trying to figure out what's wrong rather than just take a good history, right?
Sure, yeah.
Utilizing an interpreter. And so it's a lifesaver,
Hmm.
literally a lifesaver to have a qualified interpreter. And by qualified, someone that has been trained and their language proficiency in both languages has been determined to be proficient
Absolutely.
at least an intermediate level.
Absolutely.
Mm-hmm.
Now, for the audience who's listening to this episode, and I'm thankful for almost 1,200 downloads per day on this channel. I really
Wonderful.
appreciate you listening in on this one. So this is a little different what Dr. Lee's talking about than you taking your cousin or your brother to do the translation for you or to do the interpretation for you. They may not be well versed in the medical terms. I think that's where Dr. Lee is alluding
That's
to here in
correct.
her conversation. They may do a good job in doing the administrative stuff and translating for you that way, fine. But when it comes to a doctor to patient discussion, this needs to come in from somebody who is trained on the topic. Correct me if I'm
That is exactly correct. And here's the other thing. Let's just say that they are proficient. Maybe you bring along a nurse. You have the added issue of confidentiality. What if you are not ready to share your medical history with your family
true,
members,
yeah.
right? And so that's
And the
you know
liability too, Dr. Lee, right? So
correct,
if let's say God forbid something bad happens, the doctors can wash their hands out of it.
correct, correct.
Yeah, the medical interpreter was not approved, right? So I mean, you're using something on your own here.
Well, the onus to use a qualified interpreter really comes from the doctor. Now, as a patient,
Hmm.
you can waive that right, but they are the ones that have to utilize a qualified interpreter.
Dr. Lee, who pays for that service? Is it the patient or the medical establishment?
The medical establishment has to pay for that.
And is there a way for the medical establishment that says, I don't want to pay for this. I'm not expensing that.
It's a law. It's the civil rights law here in the state, here in the in the country of the U.S. I don't know how it is in Canada,
Yeah, yeah.
but in the country, in the U.S., it's a requirement because it is a law. Now, unfortunately, it's an unfunded, non-funded mandate in that the federal government does not cover the full cost of it. In certain states, Medicaid might cover most of it. Some insurances might cover it, but the majority of it is borne. The brunt of it is borne by the health institution,
You mean the health institution, be it the hospital, whoever providing the care.
hospital or clinic or provider.
And so, you talk a lot about the intersection between language and leadership. How does that work for you? What's your take on that one?
I have been a leader most of my life. I believe that's one of the reasons I went into healthcare administration because I thought, well, I'm a natural leader, so I might as well. But here's the thing: in this space specifically, I was able to utilize my leadership skills because we didn't have certification. So it was not even considered a profession until there was a certification, a national certification where providers could say, we're only going to hire certified interpreters. And now they can do that. So as of 2009, actually 2010, when the certifications came online. And I'm very grateful that I was part of that. really and truly, leadership is just having a vision and executing
Yeah.
that vision.